Welcome to this very special edition of the KAJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through the industry insights, information, or simply learning from them. And today we have Belldon Colme. He calls himself a disease reversal expert. He's a recognized expert in undoing common health problems and lifestyle transformation. Welcome to the show, Belldon.
Thank you very much, AJ.
You are welcome to the show, Belldon. You are welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk about. We'll be talking about body, mind, spirit alignment, and health. But my first question to you, Belldon, is to understand for the audience, why do you call yourself the disease reversal expert? Tell us a bit about yourself, about your background. I don't know if you are a doctor or not, so that people, can take your advice in that spirit, in that understanding.
Certainly. I am not a medical doctor. I am a cellular biologist and biochemist, and I come from disease from the standpoint of those sciences, not from medicine. And the advantage of that is when I was 39 years old, before this journey started for me, I had my first of 3 heart attacks. I had 3 heart attacks within 2 years. And at that time, my doctors were telling me that my diabetes and my heart disease was not overcomable. I was going to die from these things, and it wasn't going to be very long. My shelf life, if you will, was only going to be a few years. And that's what got me diving into the sciences, particularly cellular biology and biochemistry, because I believed if I could learn how this works, how the body works, I could also learn how to support it. And if I could support it, then my body could heal. And so that's what I dove into, every rabbit hole I could find to study how my body worked. And sure enough, within 2 years' time, I'd reversed diabetes. I'd lost 105 pounds. I'd reversed heart disease. I still remember the look on my cardiologist's face when he took me off my last medication. And I've been disease-free now for 18 years. And I've continued to study what I need to know in order to help other people to do the same, because there's no reason to stay sick. There's just no reason.
Right. Absolutely. Absolutely, Belldon. And this is commendable. Means this is such a great thing. But then when you were doing all this for yourself, all the study, all the research, if we may call that, were you doing it for yourself, or you had that long-term thing in mind? How did you go around doing your research? Can others also do the same whenever? Because at that time, the mindset is of, listening to the doctor. Every advice will come that listen to the doctor, do what he says, or he or she says, and then, try and live as long as possible. Forget about the curing yourself part. So I want to understand your mindset at that point in time, and then also about doing good for the society now.
Certainly, certainly. And thank you for the question. It is a mindset for people to just go to the doctor, do what they say, and take the medications. But it's important to understand that even your doctor doesn't tell you he's going to heal you. Your doctor wants to manage your disease. And by managing your disease, you're going to continue to have it. You're just not going to hurt as much. You're not going to have as many symptoms as you would otherwise. And that's the purpose of the medical profession. And I am 100% in favor of medicine, because they kept me alive long enough to learn what I needed to learn for my body to heal. There's definitely a place for the medical practice. In my mind, it was really important for me to do what I had to do for myself, and that meant investing in myself. I'm not going to lie, what I learned cost me over $120,000 in education, in research, getting to the data that I needed to see in order to learn what I needed to learn. It was a big expenditure of time, a big expenditure of money, and I was dedicated to do that for myself. So many people I hear today are in a frame of mind where they're not ready, they're not willing to invest in themselves. And you don't have to invest $125,000. There's other ways to do it, and there's people that you can learn from. But you have to be willing to put your money and your time and your commitment into yourself. If you're not willing to do that, then you're going to wind up with an iPhone and 5 TVs and sick and dying. You have to have that as your priority. And I did. And that's why I was willing to do the work that I did. And again, share it now where people can learn at a much less expenditure, but you still have to have the mindset that your health comes first and that your health is foundational, or else you'll never take that step.
Right, Belden. So, what did you learn when you went deep into this understanding of the human mind, human body, human spirit? What did you learn? And did it surprise you that there are so many things we don't know about ourselves, even in the physical form? And also, what way did you look at this whole gap between how the medical science looks at it? They try their best, but that's where they are. There is an end to that understanding till now. But when you start looking at, then you find a new understanding about yourself, about the human body, and also that there is, much more beyond that the present medical science tells you about. Help us understand this sort of learning that you must have got because you cured yourself.
Yeah, there were 5 things that were really important when I first started learning. And at the very beginning, it made me angry. It made me angry that we don't know this because it's not really that difficult. The first thing I learned is what energy is in the body and how important it is. That energy is a molecule that lives in every cell of your body. It's called adenosine triphosphate, but we'll just call it ATP for short. But this molecule provides energy to every living thing on Earth, from mice to mushrooms to people. And this molecule is absolutely essential to us healing. If we don't feel energy on the outside, if we feel fatigued and tired, we don't have energy on the inside either. And without energy on the inside, the body can't heal. So we need to focus on getting our energy back, and that doesn't come through food. It lives in our cells. We just need to get the right chemistry in our body so that it works. The second thing that I learned was that metabolism is not a fat-burning furnace. And we keep being told about how our food is burning and our fat is burning and this is burning. There is no fire in the body. Nothing burns in the body, and that language is very confusing. Metabolism is very simple. It just takes things apart and puts things together. For example, it takes apart our food and puts it back together in the cells of our body. And when you realize that food is not energy, food is what we're made out of, it changes how you think about food. If it's all going to burn for energy, who cares what I eat? But if I'm being built out of it, suddenly it matters what I eat, right? And then the third thing was a building on that, what foods heal the body and in what balance. And it came really, really clear that the body is chemistry. Everything happening in here is chemical reactions and responses. And chemistry is only 3 things. I mean, yeah, it sounds confusing, but it all boils down to put the right things in the beaker to get the reaction that you want, keep the wrong things out because they pollute that reaction, and get the right balance of things. So for the body, that's the right food in, the wrong food out, and the right balance of foods. And it was really funny. I gave a speech at a hospital up in Washington State here in the US. And I was talking to doctors who at first had that look on their face like, who is this guy to talk to us? And nurses and the medical staff. By the end of that presentation, I had doctors coming up to me saying, I remember this. And I said, I know you do. It was your first year. This was all your first year education. But after the next 8 years of learning pharmaceuticals, that becomes what the doctor knows is pharmaceuticals. The other things that they learned kind of got pushed out. But then the last 2 things that were important to me, besides the mechanics of how it all works, was the reason that nobody seems to be able to stick to it. And that reason is things like emotional eating, which is our emotional connections to food or connecting negative emotions to food, and overwhelm or lack of motivation. So these 2 things became very important in my learning as well. And while I do not have a degree in psychology, I've spent a lot of time studying what causes these mechanisms in people so that I can help people overcome those as well. Because knowing what to do doesn't matter if you emotionally can't do it. So we help people in those areas as well.
Wonderful. And then use that learning into your thing while taking medicines, and then the your routine, your way of diet, looking at food, looking at metabolism, looking at energy, everything started giving you results. When was the first time you started seeing those positive results for yourself?
Once I've figured out how this works, how to work with it became pretty obvious. So by my first year in, I was developing a way of eating that I call the 4 jars. It's a simple way to divide food into 4 categories. Even if you don't know what that food is, you're going to India for the first time, you can look at food and know what category it goes into and how to divide it up for yourself. And when you know these 4 categories and you eat from these 4 categories each day, you're getting the right things in. First law of chemistry. And then I developed an understanding of processed foods and what's happening in the food supply chain today. And I started realizing really quickly, if a food cannot exist without a factory, if it just cannot exist without a factory, it's not real. It doesn't belong in your body. That's how we keep the wrong things out. It's an easy definition. If it can't exist without a factory, don't put it in your body. And the third thing is the balance, to get the chemistry in the body right. And when I developed this, I put it into what I now call the 4 jars diet. But I started eating that way. And once I started eating that way, it took 3 months to reverse diabetes. It took 7 months to lose 105 pounds. And by the end of 11 months, I was into my cardiologist and starting to get weaned off my medications. And almost 2 years to the day from my heart attack, I was free of heart disease as well. So once you're working with the body, things happen very, very quickly. It doesn't take a long time. We just need to be committed to do the right things for it.
Right. So, how many years did it take for your learning and then for weaning yourself of all the
Well,
medicines?
20 years and counting. I'm still learning and I'm still taking courses and I'm still widening to learn more about how to help people be successful, not just in the food, but in the psychology and in the emotional side. And I've gotten addicted to learning. I hope I never stop.
Right. So, at 39, the doctor gave you 5 years, you went into learning, and then within next 2, 3 years, you came off all the medications.
Within 2 years' time. Yeah. And I'm 59 today. I got to catch up with my birthdays. I'm 59 today and still disease free. And I've got more energy, more stamina today, pushing 60 than I had when I was 39 by far.
Yeah, yeah, I can see that. I can see that, Belldon. You are very, very fresh early in the morning, full of energy. And so you focus a lot on diabetes as well as chronic diseases. So help us understand, how should people look at or relook at these things? Are they caused by processed food? Are they caused by anything else? How would you like to look at it? Because this is spreading like wildfire all across the world. Even in a place like India, which has a very traditional system of eating, we have in India, we have this saying also that, jaisa khaoge waisa sochoge ya banoge. It means that the food you eat, the way you will think like that, and you will become like that. So, but here also we are not away from all these problems of chronic illnesses, chronic diseases, as well as diabetes. So help us understand, how should we look at ourselves, our food, our illnesses, these sort of chronic illnesses. So your research will certainly help a lot of people here.
Yeah, there's absolutely no question that everywhere processed food goes in the world, disease follows. And it's a different kind of disease. If you go back 100 years in our history, before processed food, disease was viral or bacterial. We would get sick from a virus, we would get sick from a bacteria. Chronic disease was rare. It happened, but it was rare. With the food system that we have today, diseases that are not viral, not bacterial, they're 100% caused by what we put into our body, are the fastest growing diseases on the planet. Diabetes today is the fastest growing disease on the planet. and it follows processed food. Everywhere processed food goes, in just a short period of time, diabetes follows. So food is the number one. It's definitely not the only. It's not the only cause, the end all be all, but it definitely is the primary cause of the explosion of chronic disease. So if we can take that one step of eliminating processed food and get back to cooking, that requires that we be careful, because we might have fresh meats, we might have fresh vegetables, but we take our sauce out of a bottle. And that bottle is full of the additives and the chemicals that are processed food. And we take the fresh food that we're cooking and we ruin it by putting a processed product on it. And yes, it makes it easier and faster, but the toll it takes on the body is huge. So if we can take that one step of not having anything in our house that contains additives that don't belong in the body, we'll improve our health immediately. The other steps of getting the right things in and the right balance is going to get us to a level of energy and a level of life enjoyment that is just amazing. But that one step will go a long ways all by itself.
Right. So just process, are all processed food bad? Because it came out with the with the whole process of our development, so-called development, that it will keep your food usable for you for quite a bit of time. A lot of people say their lifestyle requires this sort of a thing. So how do they look at this part, where or are there different sort of processed food, which are, some processed food are okay, some are not? How do you look at that part? Because if we say you start cooking at home, for many it will not be a idea which can be digested so easily. So how should they look at or calibrate, say, this sort of thinking, as well as the type of processed foods we have in our lives as of now?
Yeah, definitely we live in a society that values convenience. And convenience reigns king, saves us time, saves us all of these things. When you look at processed food and the additives, I divide them into three categories. Preservatives, we know what those are. Those are the things that give your food the life. And enhancers, these are the things that make creamy things creamier, sweet things sweeter, salty things saltier. And conditioners. Conditioners allow manufactured food to be consistent. Every single loaf of bread is going to be exactly like the one before it, right? And conditioners allow us to do that. But taking just one of these, I want to have your listeners apply a little bit of common sense thinking, because a preservative is designed to prevent food from spoiling. Food spoils from the action of bacteria, so a preservative stops the action of bacteria. The problem is we digest our food by bacteria also. So if a preservative stops the action of bacteria and we put it in our body, what's it going to do? It's going to stop the action of the bacteria that helps us digest our food. So even when we're putting food in our body that's the right food, but it's covered with bacteria, we cannot digest it properly and we can't assimilate it. And we wind up going into a state of malnutrition because we're not able to assimilate that food. So even though a preservative does great things on the shelf and it looks on the surface like, wow, we can solve the world's food problem by being able to maintain it for longer, it's hurting us on the inside and killing us on the inside. So it's solving a problem for food companies, but it's hurting and creating a problem for individuals. And that's where the individual has to take control of their own body and their own, where they want to go. It's not a government's job to protect individuals. It's a government's job to protect populations. And that's what they're trying to do. But on the individual level, we have to decide if we're willing to pay the cost that comes from that. And preservatives are just one example. What enhancers and conditioners do to the body create all kinds of problems.
Absolutely. So we have to leave a bit of convenience. Yes, if you are going to Mars and you need that food to last for long, then perhaps a bit of preservative is okay. But on Earth, we can still do without it.
Well, there are ways that we used to preserve food that we've lost. We used to preserve food in a number of different ways, not just refrigeration, but we had salted meats that were used natural salts, not the processed things that we have today. And there are other ways to preserve food. But I think the biggest thing to consider is just falling in love with cooking. Because when we fall in love with the process and it becomes something that we enjoy, and mind you, for me, I hated cooking when I was 39. That's why I ate everything out of a box. But I've learned to really enjoy it. And when I have guests to my house, I invite them to the kitchen the way it used to be in the old days, where that is a place to congregate. That's the place to cook. And by finding joy in it, it's not a chore. It's now fun. It's enjoyable. And when it's fun and enjoyable, you don't mind doing it. You don't mind going to the market every 2 or 3 days. It's something that just becomes an enjoyable part of your life. It means less TV, but that's okay. That'll benefit you in other ways.
Absolutely. Absolutely. So how are you spreading this whole idea, all the learning, all the positive impact that you have gained? How are you, spreading this to the world, apart from the doctor conference you talked about?
Yeah, I do public speaking all over the place. My company is in 8 countries around the world and growing. And the main thing that I'm doing right now is the 4 jars, the way of eating. I give that for free. I want the world to know the food that heals their body. And so we give that away for free. And your viewers can get a copy at 4jars.com. Just that easy. It's a free download. I won't even ask your email address and phone number. Just download it, read it, learn it, use it, because this is going to change your life. Now, it's information, and we all know that if information fixed us, we'd all be skinny, rich, and happy, right? But information doesn't do it. We have to take action on that information. So download it, take action on it. If you need help with it, there's a link in there where you can call my team, and we're happy to give you help in implementation and learning how to do it. If you're a driven person, just download it and do it. It'll change your life.
Absolutely. Not only change your life, it will save your life before you come to that situation. Even in medical science, they say prevention is better than cure. But why to even reach that stage? Just do it whenever it is possible, and the time is now.
So much, yes.
Right. There is much to learn about all these things from you. Well done. So a lot of people who would like to understand things from you, more about you, what you are doing, what is the best way for them to connect with you?
You can go to belldoncolme.net, but I really recommend that you start with 4jars.com and just download it and see it. You're going to learn a lot about me just from learning what that does for you. And then you can come and learn about me later, belldoncolme.net.
Wonderful. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for joining us.